Today we're discussing inflammation and how it is closely related to cancer. Inflammation is an underlying phenomenon that's common to most cancers. Hi, I'm Dr. Sharmin and I shall talk about inflammation, what causes it, how do we recognize the presence of inflammation in our body, and how do we reduce the presence. I shall also be sharing two very useful cancer prevention tips towards the end of the video, so stay with us. Inflammation is our body's response to an injury, irritation, or infection that happens to us. So it's our body's natural defense mechanism and it is friends with us. Mostly when we are injured, the first response that happens is acute inflammation. Therefore, when we cut our hand or injure it, the inflammatory process sets in and that's where the redness happens, the swelling, the loss of function, and pain develops. So this is an inflammatory response to the injury. Now this type of inflammation is acute inflammation. That is, the timeline is very short, it just appears and it disappears over a period of time once the healing has happened. Acute inflammation is healthy and is important to promote healing. So it is friends with us. Now trouble arises when this inflammation is present for a long period of time and our body's immune system is unable to clear it. That's when inflammation gets unhealthy, giving rise to a large number of diseases like diabetes, heart disease, and cancer. So it is this long-standing or the prolonged inflammation that is present in our body for prolonged periods, is not going away, it's not getting cleared by the body. That is when the trouble arises and it gives rise to a large number of diseases. Now, chronic inflammatory diseases are the most significant cause of death around the world. The World Health Organization ranks chronic diseases as the greatest threat to human health. Around 3 out of 5 people all around the world die because of chronic inflammatory diseases like heart disease, chronic respiratory disease, diabetes, cancer, and obesity. So what are the factors that give rise to inflammation in our body, and especially the long-standing inflammation? Now mostly it is because of smoking, drinking alcohol, and obesity. Also, there are wrong foods that promote chronic inflammatory processes. Exposure to radiation, environmental pollution, and certain infections like hepatitis, H. pylori, and HIV, they also promote inflammation and therefore lead to cancer formation. Not only this, lack of physical activity, isolation or feeling of loneliness, lack of sleep, these are additional factors that promote inflammation. The next question is how to recognize chronic inflammation. It is hard to recognize the presence of chronic inflammation in our body. In fact, obesity is considered as an inflammatory state. And the majority of the time, the symptoms and signs are mostly ill-defined and vague. They do not point to the disease. So, presence of fatigue, for example, low energy levels, presence of stress or any ongoing pain, any allergies or asthma, and certain digestive problems like bloating, indigestion, abdominal pain. These are all suggestive of presence of chronic inflammation. Now the question is there any method by which we can test if there is presence of inflammation in our body? Yes, there is a test called C-reactive protein. It's a biomarker present in blood which can be done through collection of small amount of blood, and the test can be performed to assess any inflammatory condition present. It does not point to where the inflammation is, but yes, it does tell about if there is presence or absence of inflammation. The question is how to reduce the presence of chronic inflammation in our body. The studies indicate that by doing just 4 things, which include eating a healthful diet, by being physically active, choosing not to smoke and drink, and being an optimum weight throughout the lifetime, leads to a reduction of about 50 to 70% of cancers by reducing inflammation. So we need to avoid factors that promote inflammation, and this includes reducing or avoiding smoking, avoiding wrong food choices, being more physically active, reducing presence of stress in our life. If we have stress, then we need to learn to manage it well, sleeping well, and addressing mental health issues if any, for example depression. Also, reducing our weight, coming to an optimum body weight, and avoiding obesity and being overweight for most part of our life. Reducing alcohol use and abuse both. Treating infections wherever possible. Ask your doctor, get yourself treated at the earliest to avoid the chronicity of infections. And reducing prolonged exposure to pollution and radiation. So the number one cancer prevention tip is to reduce the presence of chronic inflammation in our body, as chronic inflammation is linked with a large majority of cancers. It is seen that inflammation is an underlying phenomena which is common to most cancers, and by reducing inflammation alone, we can significantly reduce our risk of getting cancer. And my second cancer prevention tip is to go for a C-reactive protein test on a regular basis in order to check if you have a chronic inflammatory condition. You can speak with your doctor and ask for the test. What are the components of an anti-cancer lifestyle? We shall be discussing this and more in our next video. Thank you so much.